the number two most common exclusion for female physicians?
Yeah, absolutely. So that would be pregnancy. And this can jump into a whole bundle of conversation in regards to pregnancy. Pregnancy is actually the leading cause of short term disability, but we often see pregnancy exclusions, especially for women who are currently pregnant, for women who have had a history of pregnancy complications. This could be gestational diabetes. As physicians, you may not see a complication as cesarean section, but the insurance company sees cesarean section as a complication or a increased risk. And because it's the insurance company's job to mitigate risk or to examine risk, a lot of times clients with a history of C-section will get pregnancy excluded even in the future. Unfortunately, that's just what it is. But that's very, very common. Just kind of seeing those pregnancies excluded, especially if it's current. Your pregnancy is going to be, excluded the current pregnancy. But a lot of women, especially in regard to that current pregnancy, confused, is this coverage going to cover my pregnancy? And the answer is no, because we're talking about long-term disability insurance, and that's different than like short-term disability insurance or maternity leave.
Totally. And that is such a helpful distinction. I remember the first time you explained it to me, a small light bulb went off and I was like, "Oh, okay. That's super helpful just in terms of even a jumping off point." And again, this is a topic that we'll dive deeper into for pregnancy, fertility, and similar topics for female physicians.